This presentation focuses on the importance of medication safety and the importance of adverse drug reactions. A recent study showed that medication errors are actually the third leading cause of death in the United States. Heart disease is the most common cause of death in the United States, with over 600,000 deaths per year. And cancer, almost 600,000 deaths a year, is the second leading cause. In the literature, or in public record, respiratory disease is considered the third leading cause of death, with 147,000 deaths per year. However, in this study, they estimated that 250,000 deaths each year are caused by medication errors. So you can see that that exceeds the number of deaths from respiratory disease. So this would make it the third leading cause of death in the United States. However, medication errors are usually not reported as the cause of death, and that's because the cause of death is reported by the diagnosis that the patient had upon admission. There are no ICD codes for medication errors, so they don't get recorded officially that way. The 5 rights of drug administration is one way we can avoid medication errors, by following these very closely. The first right is right medication. Many drugs look alike and sound alike, so drug knowledge is so important in making sure the correct drug is selected. The right dose is also very important. In fact, I've assigned you to take a look at Dennis Quaid's YouTube video about how his 2 twin babies were given an overdose of heparin. The right time is very important, and missed doses occur very commonly. Of course, the right route of administration. It has to be given, either IV or PO or however it's ordered. It has to be given by the right route, because doses given by the wrong route might overdose or underdose the patient. The right patient, of course, that's very important. The 6th right, according to your textbook, is correct documentation. I mentioned that missed doses happen all the time, and it's probably one of the more common errors that I saw when I worked in the hospital. Why do you suppose missed doses are so common? Well, first of all, nurses are very busy. They're sometimes too busy to get all the medications in on time for their patients, and they're short-staffed. Besides that, patients have many interventions. Sometimes all the interventions and tests that they're going to makes it impossible to give their medications on time. They may have transfusions, diagnostic tests, blood draws, other medications, and it's just hard to get them all in on time. Well, why does it matter if doses are missed? Well, there's many reasons it matters. For example, a missed antibiotic dose can cause resistance or treatment failure. A missed dose can cause a disease exacerbation. For example, for anti-epileptic drugs, you miss a dose, the patient may have a seizure. A severe reaction may occur. If a diabetic patient doesn't receive their hypoglycemic drugs, they may become hyperglycemic and severely ill. I worked for 32 years in a large teaching hospital, and I had many experiences with medication errors. One of the earliest ones that I can remember was a patient in the MICU with multiple medical problems early in the 1980s. Maalox was commonly given back then to prevent stomach acid from refluxing up the esophagus. And this patient had an order for Maalox, 30 mLs every 2 hours per the NG tube, nasogastric tube. So the patient was too sick to swallow, so had a tube that went down into his stomach. However, the Maalox was given IV in error. Maalox is a suspension, which means it has tiny solid particles suspended in a liquid. So when it was given IV, these tiny little particles can lodge in the lungs and the heart and cause much damage. So what happened to the patient? The patient actually died as a result of this error, so you can't get worse than that. I also, in my career, have been an expert witness on adverse drug reactions that have occurred that have had very serious consequences and resulted in lawsuits. This first one I want to tell you about is a 75-year-old man who recently had a stroke, and he weighed 75 kilograms. The stroke was caused by a blood clot, and so they ordered heparin 5,000 units loading dose and then 18 units per kilo per hour. After 48 hours, the patient had a massive cerebral hemorrhage, and he remained in a vegetative state for a year before he finally died. Now, the dose that was ordered was the standard dose. So what was wrong? What went wrong? Well, heparin requires an every 6-hour PTT, or a blood clotting test, to be ordered and monitored to adjust the dose so that the patient receives the correct dose. And the desired PTT is between 60 and 70 seconds for heparin. No PTT was ordered. When the bleed occurred, the heparin was stopped or DC'd, and a PTT was drawn. That PTT was over 180 seconds, which means it was too high to measure. Even 12 hours later, the PTT was still too high to measure, so the patient received a massive overdose. Another case I was involved with was a gentamicin overdose in a newborn. This was a term baby boy weighing 3 kilograms who developed sepsis, which is a serious infection, on day 1. Gentamicin 2 milligrams per kilogram IV every 12 hours was ordered, along with ampicillin 50 milligrams per kilogram IV every 8 hours, and he was to receive 10 days of both drugs. Pre- and post-dose gentamicin levels were ordered and drawn on the 3rd dose. Now, this is very important to individualize the dose, so the levels are drawn, and then the dosage adjustments can be made to make sure that the dose is appropriate for the patient. The pre-dose level was 3.5, the post-dose level was 12. These are very high. The desired pre-dose level is less than 2, and the desired post-dose level is 6 to 8. So the dose interval should be changed to every 24 hours. In other words, you're going to be cutting the dose in half because 1 dose a day will be eliminated. However, no dose adjustment was ever made. No one ever interpreted the levels. So the child went on to receive twice the dose he should have received for the 10 days. Later, the child was diagnosed with complete hearing loss, which is a known side effect of too much gentamicin. And complete hearing loss is a very serious handicap for a child to have because it impairs learning. He later in his life received cochlear implants, but of course the plaintiffs won the lawsuit. This study looked at emergency room visits and hospitalizations for adverse drug reactions in patients over 65 years old. From their data, they estimate that about 100,000 patients are admitted through the ERs in the U.S. each year due to adverse drug reactions, and half of those are for patients 80 years old and older. Nearly 66% of the ER admissions were for unintentional overdoses. Now, this doesn't necessarily mean that the patient took too much medication. Drug accumulation can occur in older adults for many reasons, such as impaired renal function or impaired liver function, or just changes in diet, weight loss, or drug interactions as drugs are added or deleted from their regimens. Also note that 40% of these hospitalizations, the patients were taking 5 to 9 other medications along with the implicated drug. Hospitalizations for adverse drug reactions are likely to increase as Americans live longer, have greater numbers of chronic conditions, and take more medications. Notice that among adults 65 years or older, 40% are taking 5 to 9 medications, and 18% are taking 10 or more. The drugs most commonly involved in causing serious adverse drug reactions in this 2007 to 2009 study were warfarin, an anticoagulant, and insulin. Anticoagulants' most common adverse drug reaction is bleeding or hemorrhage, and in 40% of the cases in this study were caused by GI bleeding. Insulin and the oral hypoglycemic agents, most common adverse drug reaction is hypoglycemia, which can cause loss of consciousness, seizures, and even neurologic damage. So it must be treated very quickly. And that was the second and fourth most common admission. The third most common drug that caused admission was digoxin, which is used for atrial fibrillation and congestive heart failure. It's not as used as much anymore, but it can cause serious side effects. The opioid analgesics, such as Percocet and morphine, were the sixth most common cause in the elderly adults for admission to the ER. I believe, with the exception of digoxin, the types of drugs that cause ER admissions to this day are very similar. The opioid analgesics are probably quadrupled because of the heroin and opioid crisis that we're experiencing right now. Thank you.